4 Nairobi Hospital board members have members arrested over the weekend were this afternoon released on bond after spending 2 nights in police custody. Dr. Job Obwaka, former board member, former chairman, I beg your pardon, Dr. Chris Bishage, vice chairman, Samson Kinyanjui, and board member Valerie Gaya, all pleaded not guilty at Milimani Law Courts. Meanwhile, State House issued a statement today acknowledging the president's involvement in the matter, as Health Cabinet Secretary Aidan Duale insisted that the government's only interest is serving the institution.
At Milimani Law Court, the accused Dr. Job Obwaka, former board chairman Dr. Chris Bichage, vice chairman Samson Kinyanjui, and board member Valerie Gaya spent much of the day in police vehicles in the parking lot, waiting for their charge sheet to be registered. The charges against Dr. Obwaka run to 4 counts. Count 1, procuring the registration of 334 members by false pretenses, contrary to Section 320 of the Penal Code, alleged to have happened between July and December 2024. Counts 2, 3, and 4 relate to failures to lodge amended articles, financial statements, and a membership's register with the Registrar of Companies.
In fact, there are many doctors even who are here.
The defense, led by LSK President Senior Counsel Charles Kanjama, urged Milimani Senior Principal Magistrate Teresia Nyagena to consider the age and standing of the accused in setting bail, noting that all 4 had been granted anticipatory bail before their arrest, bail the police chose to ignore. The magistrate released all 4 on a personal bond of 5 million shillings each, with 2 contact persons. But before that, the proceedings were briefly suspended when Dr. Obwaka fell ill. An ambulance from Nairobi Hospital was called in to stabilize him. Across town, a group of senior doctors, some with 4 to 5 decades of service at Nairobi Hospital, made it clear that they had sought the president's help. Consultant pediatrician Professor Stephen Budhia painted a picture of a hospital hemorrhaging money and patients.
The board actions have plunged the hospital into a slew of litigations, with legal fees skyrocketing to over 680 million in 2024 alone. We are not talking about 2025 and we are aware that these court cases continue. Many of them continue. All of these court cases have been in a bid to retain leadership.
On the manipulation of members' register, which sits at the heart of the charges, Budhia was equally direct.
A number of board directors engaged in bold-faced move to capture the hospital by loading over 300 individuals into the members' register, who were then transported to the hospital in buses to vote at the hospital's annual general meeting on 4th December 2024.
Section 800 procedure, which is empowered by statute by way of the Companies Act, and it is on that basis that investigations were actually launched into the hospital. When those investigations were launched, various things were discovered. One, various documents had been hidden in various parts of the Secretariat's office. Various documents were also recovered from the incinerator, and those are things that were actually reported to the courts.
But it's still a mystery why Dr. Obwaka was arrested and charged.
Dr. Obwaka is a dedicated doctor. I know him, not at a terribly personal level, but I'm very fond of him for what he was trying to do. And on a personal basis, I think his being rounded up with the others was a mistake.
By evening, State House had issued its own statement confirming that President William Ruto, who is the patron of the Kenya Hospital Association, as other presidents before him, had received written memoranda from doctors, members, and patients raising concerns about governance and financial mismanagement. A multi-agency investigation team was set up and appropriate directions were then issued to relevant agencies for action in accordance to the law.
So neither the President, nor the Minister for Health, nor any government official has any interest. We have absolutely no interest. Our interest is only one. How do we preserve the first-class national and regional health facility That is in our country.
The accused will return to court on the 31st of this month. The Nairobi Hospital treats more than 290,000 patients every year and supports over 700 specialist doctors. And now the hospital has almost everyone talking. Chairman of the Board of Management, Barclay Onyambu, said in a statement that the facility continues to operate under the articles of the Kenya Hospital Association and that the hospital is stable and continues to deliver services across all departments. Catherine Omwando, NTV.